My name is Dr. John Lawrence, and I am a naturopath and a chiropractor and a chiropractic neurologist and a medical assistant. And I'm with a group called Advanced Rejuvenation, and we have been utilizing regenerative medicine for almost 30 years, and quite a bit longer than most people. Stem cells and regenerative medicine has actually gotten a little bit trendy in the last few years, and what I'm hoping to do tonight is to make a lot of sense of this so that you're able to make decisions for your own self so that you get the best care available. I love talking about this. This is dear to my heart. You know, I think in life we're dealt challenges, aren't we? And it depends on how we meet those challenges and we deal with those challenges. And oftentimes when we can overcome them, we're able to learn from them and we're able to help other people, right? And so I call that a pain to purpose or pain to passion. And so I've got a few of those, and I'll share those with you as we kind of go through this evening. Let me start with my first story of the evening. So I graduated from chiropractic school in 1996 and immediately started practicing what I would consider traditional chiropractic, where I was doing a lot of adjustments on patients. And for those of you that may not be familiar with that, it's very physical work. And I was treating a lot of patients in their neck and their back. And I was headed home one day after work, and I was heading out to Siesta Key where I was living at the time. And a car pulled out in front of me, and I slammed on the brakes, and my car ran into this other vehicle. And the energy went through my leg and into my lower back, and I immediately started to have pain, searing in my lower back and shooting down my leg all the way to my foot. And I'm like, well, this is not good. And up until that point, I had been pretty healthy, and hadn't had any severe injuries. And so I did what anybody would do. I went to the doctor, went to my doctor, and he said, you got to get an MRI. And I'm like, let's do it. And the MRI came back, and it correlated perfectly to my symptoms for a disc herniation. And it was pinching on the nerve on the right side. So he says, you should probably go to this neurosurgeon and get a surgical consult. And so I went to the top surgeon at the time in Sarasota. This guy graduated from Harvard, excellent pedigree, and he'd been practicing for many years. And I figured if I'm going to get a real straight shot and know exactly what I'm dealing with and what I'm going to look forward to, this is going to be it. So I take my MRI and I go to this doctor, and he checked my reflexes and so forth. He didn't really feel around on my back, but he put the MRI up and he looked at that for a good long time, and he said, you're going to need surgery someday. You're going to need surgery. I would like it to be if we could last as long as you can, and you're a chiropractor, if you could get chiropractic and massage, whatever you need to do to try and delay it, because I was still in my 20s. And so I left that office absolutely certain that I knew what was wrong and what I was hoping to get, which is surgery, right? I love this quote. It ain't what you don't know that gets you into trouble. It's what you know for sure that just ain't so. Sorry. The trouble with old men is they remember so many things that ain't so. Women too, right?
No.
We all have that problem.
I didn't say it.
I was certain that I had the right diagnosis. I had an MRI and I had a Harvard graduated doctor telling me what was going on. And so it was 6 months later, a doctor, is a friend of mine that was just graduating from osteopathic school, and he was into this technique called Prolotherapy. How many people here by a show of hands have ever heard of that? Prolotherapy? A couple, okay. So he's telling me, he's so excited, he's like, this fixed my back, and it's a sugar water. It's a special sugar, and we inject it into areas in the body, and it creates a healing cascade. And I'm thinking voodoo, yeah, whatever, right? You know. And he says, no, really, this is really legit medicine, and it's been around for a while, and there's some research on it, and he said that even though you have this MRI that shows that it's all this correlation, it doesn't mean that your pain down your leg and in your back is coming from that disc. And of course, I still thought this guy was, you know, a fruitcake, because I was absolutely certain, right? And so I was entertaining the conversation. So he offered to me this. He said, "We mix lidocaine with this sugar, and I want to lay you down. I want to inject the ligaments that I think are causing your problem. And then if you get up and your pain's gone, it's likely that the disc wasn't causing the pain because I'm not going to inject the disc." And I'm thinking, and of course I start thinking in the back of my mind, I says, well, why didn't this Harvard doctor do that to be absolutely certain it was my disc? This guy's got something that he's doing special, better than this Harvard doctor? Okay. But I was still very skeptical, but I agreed to it. I figured it really couldn't cause me any harm, so I laid down and he injected some spots in my back, and I got up and I could not believe that my pain was completely gone. The pain in my back and the pain in my leg, and I'm like, wait a minute, like, come on. I thought, for a minute there I was thinking, you must have injected the disc. And he says, no, I injected your iliolumbar ligament, your SI joint, and that's common to refer down the leg. And so he starts showing me these different referral patterns that are out of these textbooks. And I'd never seen any of this stuff before, so it's like really just blowing my mind. So I had a few of these treatments, and I have never had surgery on my back. And this is quite a few years ago. And this was the beginning of me really starting to realize that there is a really big difference between how people are treated and what's really wrong with people. And so it was the cause and the effect, right? What was causing the pain? What was the effect of that? And getting the cause and the effect right makes all the difference. And we're going to get into that and try to connect some serious dots for you guys tonight so that you're going to be able to look at your own issues and start thinking about, okay, this is really what I'm dealing with, so that you can start using your own thought process as far as like the things that you're going to want to look for to get better versus just masking the symptoms and taking medications that are really just treating symptoms, right? So our clinic is multidisciplinary. We have a board-certified interventional cardiologist. We're actually looking at pioneering treatment for stroke. Some of the things we're doing for stroke patients and post-heart attack and peripheral, it's unbelievable. I mean, even people that have had stroke for a while, some of the things that we're doing in regenerative medicine just are things that are generally accepted to be impossible. Dr. Bramson's a podiatrist and an orthopedic PA, and then of course me. Beth Moran's a nurse practitioner, absolutely phenomenal black belt when it comes to hormones. She was even in Suzanne Summers' book, so like thyroid and female hormones, male hormones, very, very good. So these are the referral patterns that were in that book, and 5 different referral patterns into the leg, and 4 out of the 5 are from ligaments, and only 1 of them is from the nerve root, L5 nerve root. So why aren't other doctors looking for these things? Why is it such a hyper focus on discs? Because it's big business. They got something to do there. To my right is Dr. Kaplan. He was the doctor that actually discovered the stem cell, mesenchymal stem cell. To the left is Dr. Rorden. Dr. Rorden treated that fellow there. Anybody recognize him? Mel Gibson, right? So it wasn't Mel Gibson that first went to Dr. Rorden. It was Mel Gibson that was looking for something for his father, who was in his late 90s and extremely frail. Mel took him to Panama. They ran stem cells intravenously with his father, and it was miraculous. And then so Mel was on Joe Rogan podcast, and it kind of blew up. And a lot of celebrities have thus gone to Panama, and they've gotten a lot of press from that. You definitely don't need to go to Panama. You don't need to spend $30,000 with Dr. Rorden there. You can do all that and more right here in Sarasota. So stem cells, they're our body's repairmen. They can become any tissue in the body, and they're also anti-inflammatory and immune modulating. They're very versatile. There's a lot of studies going on with stem cells in regards to just almost every disease process you can think of. Most people come to see these talks because they're interested in treatment for orthopedics, but we do a lot more in our practice, as you guys will probably discover. But I'm not going to have a lot of time to spend on the non-orthopedic. We're going to really kind of focus more on orthopedic tonight because that's what the majority of the people are here. And at the end, we're going to be offering everyone an opportunity to come in for a consultation. And for those of you that have other types of issues that you want to get more information about, that would be a good opportunity for us to kind of expound a little bit more on some of the other exciting things that we're doing. But, this is what happened to me, right? I got injured and I was taking anti-inflammatories and pain medication. And I went to the surgeon, and the surgeon would have cut on me if I was older, right? There's really nothing in between. And what we're talking about tonight is filling that void, okay? Imagine yourself 80 years ago, and Dr. Moore starts talking to you about putting a piece of metal in your body, and you never heard of joint replacement. Would you think he's crazy? Probably be scary, wouldn't it?
Yeah.
And then insurance companies, what do you think they thought about him? Were they chomping at the bit to pay for these expensive procedures? In 80 years from today, that they're still going to be putting hunks of metal in people? Or do you think there's going to be something more new and cutting edge?
Yeah, that'll be something different. New cutting edge.
All right, paint a picture. I'm walking through my living room. And I bump my shin on what? Coffee table, right? We've all done it. I got a big bruise, hematoma. It hurts bad, right? But we all know that the bruise is not the problem. The problem is I wasn't paying attention, right? But what if we had a healthcare model, a giant healthcare industry, all based on treating bruises, creams, socks, anti-inflammatories, pain medications. Sound familiar? All focused on these bruises, all the while completely ignoring that people are banging their shins on coffee tables. Well, these companies are going to make a lot of money, aren't they? It's not going to do anything for the people banging their shins. So what if we did something different? What if we started educating people about being more careful when they walk through the living room? That would make more sense. So cause and effect, that's very important. And so we're going to take a bit of a deep dive into arthritis and pain in the body in general, okay? And try to demystify it a little bit so that you can get your own cause and effect a little bit more clear. So, arthritis, this is what it looks like on x-ray. It looks pretty much like bone on bone, doesn't it? And then you go to the orthopedic, and the orthopedic says, you got bone on bone knee. We need to cut it out. We need to put you ready for a knee replacement. You come back and let me know when you're ready for that surgery, right? Well, the surgeons are taught to use that term, bone on bone, because it's motivating, but it's never really bone on bone. It's more that there's erosions, there's still cartilage there, but it's rough and it's beat up, okay? So if cartilage does indeed have a half-life of 115 years, pretty amazing stuff, supposed to last our entire life. And it's 10 times slipperier than ice on ice. It's like God made something pretty amazing there, right? But if it's so amazing, why is it getting all beat up like this? We have to start asking ourselves this critically, because things don't just happen. There's a reason that these things start to break down. And I will offer to you all that I figured it out. It's ligaments, it's connective tissue. That's what I learned way back with my injury in my back. It's like, I got it, you know? And it was revolutionary for me to realize how important ligaments were. And how when your ligaments, okay, so what are ligaments? Ligaments and tendons are considered connective tissue. They're very, very dense. When you're eating steak, it's the stuff that gets caught between your teeth. And so it's very poorly, there's not a lot of blood supply in ligaments. There's not a lot of blood supply in cartilage. In fact, when I was in school studying anatomy and so forth, it was very well understood by all of us that there is no blood vessels in cartilage tissue. It's avascular, that's what they call it. And then, several years afterwards, they found out, wow, there are little blood vessels, because then they had better microscopes where they can see it, right? So, it's the areas in our body that don't have a lot of blood supply that get us in trouble, because you got to bring in the groceries and take out the garbage, right? That was a term I heard in medical school, and that stuck with me. Bring in the groceries and take out the garbage. So the body needs building blocks because it's constantly making new cells and tissues. Stem cells are working. Growth factors are working. Your body's repairing itself. It's breaking down old, dead, dying, weak tissues, and it's building new ones. This is the cycle of life. It's happening all the time. Your kidneys are brand new every 3 months. Your musculoskeletal and your bones every 1.5 years. The lining of your stomach every 5 minutes is brand new. This turnover is natural. When this turnover starts to become slow or challenged, this is what we look at as aging or disease. So if it's these really dense tissues that become injured and the body can't heal it back, then these are the areas that break down on us and cause us pain, and it causes us challenges with being mobile, right? Because we want to be mobile and active, and you know, even if you're not into sports, you like to be able to move around, go to the store and play with your kids or whatever you want to do. And so these are the tissues that get us in trouble. So the cartilage, why does the cartilage wear out though? I kind of mentioned it, we kind of touched on it. It's loose ligaments cause instability. Instability causes cartilage wear. All right? So when the cartilage starts to wear, you lose the smoothness and you start getting more friction. And you can imagine if the cartilage is getting this type of friction, it's going to be churning up inflammation. So now, next time you realize you've got some inflammation, maybe the doctor's suggesting draining a knee or something like that, you start thinking, is it the fluid that's the problem? Is it the inflammation that's the problem? No. That's like the difference between the bruise and the banging the shin. It's the rough cartilage. And what's the cause of the rough cartilage is the loose ligaments and the loose connective tissue. So here's an example showing the knee, and you see all these ligaments that support the knee. Keeping the knee so that when you're walking around and you're moving it, it stays in a certain alignment that allows the cartilage surface to not be in a damaging scenario. Well, this is an example of an ankle, right? Ligaments are stretched and torn. Look at this. Look, you think the cartilage right there is going to be compromised, right? If you're walking around on it, you look at the knee. You know, these cartilages, they get nicked up that way. That's what happens. So we have to start thinking cause and effect. So if that's indeed what's the problem, what we need to start thinking about are what are ways that we can tighten and heal our connective tissue, and what are ways that we can get cartilage to be more smooth. Then you're getting there. You're starting to actually get a solution, right? Anything else is really just painting over rust. This is a hip. You can see all the ligaments in the hip. Really important. Now, how many people here, by a show of hands, if they had a choice between a family practitioner and an orthopedic practice to do stem cells, they would choose the orthopedic practice? Raise your hand. Okay. So I'm going to give you my own personal experience. I tore my rotator cuff, and I had an MRI. It showed I had a tear in the infraspinatus, one of the rotator muscles. And at the time, this was about 7-8 years ago, at the time we were using something called PRP, platelet-rich plasma. How many people here, by a show of hands, have heard of PRP? Wow, that's the most in any of these talks I've done. That's great. For those of you that don't know what it is, it's where we take your blood, we spin it down, and we take the healing components of the blood. So when your body heals naturally, think about this. You break a bone, you tear skin, you rip a tendon or something, it bleeds into the area, right? And that blood is liquid, but it doesn't stay liquid very long, does it? It turns into a solid. It coagulates. It turns into like a hematoma. And we don't really think about that hematoma as a graft, but that's what it is. Because it's your body basically holding space so that new cells and tissues can form within that space. And you need that. It's called scaffolding. And scaffolding is actually really important when it comes to regenerative medicine. And we use different products for scaffolding. The primary product that we use from scaffolding is from your own body, from your blood. We use that stuff as it's important. So, okay, back to my story. For a second, I had to remember. It's like a little tangent. So I had a rotator cuff. I tried PRP. I felt better for a short period of time, and then it kind of came back. I felt like I went to the gym, and I don't know if it retore. I had it done 3 times, and so I'm getting really kind of discouraged, thinking, you know what, I don't know what to do. So there was another orthopedic surgeon in town that was, putting himself out as being the stem cell expert. And I knew him socially, and so I thought, hey, I'm going to get a straight shooter on this. I'm going to go in there and I'm going to find out what the deal is. Can this get fixed with stem cells? So I go in there, smart doctor, terrible bedside manner. And he looked at my MRI, and he's like, oh, you got a tear in this muscle and that muscle. The joint is all getting worn here. I walked out of there thinking, this is hopeless, and I absolutely am going to need surgery. Just like I did coming out of that doctor with my back. I was certain. And a couple of months after that, I went to a conference in Arizona. And it was on regenerative medicine. And one of the vendors there was representing a company called MiMedx, who had a FDA-approved product that was from placenta, and they made it into a powder. And he says that we put lidocaine in with that powder, and it can be injected into tendons and ligaments. And he says it's great for rotator cuff. And I'm thinking, well, shoot, count me in. He said, I'll donate a bottle, and you can get this done right here at the conference. And one of my friends, who was very skilled with using ultrasound, which we're going to talk a little bit down the road here, but you don't want to get any of these injections done without ultrasound. Okay, very important. So I knew I could get the injection with ultrasound so it would actually go into the tear. And 30 days later, I'm in the gym, and I haven't had a problem since. And so we have treated hundreds of rotator cuffs with this product, and we still use it. It's amazing stuff. I think, you guys ever heard of Joe Rogan? He does podcasts, and he's been on TV. He calls it Wolverine Powder. You guys ever heard of the Wolverine, like the superhero? He gets shot or beat up, and he just heals immediately. This stuff is kind of like that. It's like Wolverine. Now, it doesn't work on cartilage, but it works on ligaments and tendons and muscles. We used it just last week or the week before on a patient with a really bad hamstring tear. And he felt better within a couple days. Just really amazing stuff. So, okay, so I have this treatment done, and I'm better in 30 days. Well, kind of amazing. Like, this doctor doing stem cell was like, it's not going to work with your particular tear. So if it was up to him, I would have gotten surgery. And I hear this story from a lot of patients. It's a bit of a bait and switch sometimes. And it's not only that, But I have friends that are orthopedics that are in regenerative medicine, and you got to understand their training is such that it's primarily orthopedics, and when they do injections, they're steroids. And when you inject a steroid, you don't really have to be very accurate, because you could probably even just inject it into the muscle and you're going to get a good anti-inflammatory systemic effect. So when a lot of patients receive regenerative medicine at many clinics, they'll get an injection into the joint and that's it. So when you guys are sitting here, you're starting to learn that there's a little bit more to it than just the cartilage. What about all the connective tissue? That's not even being addressed by most practices. And so one other thing that you're going to want to look for, so we talked about ultrasound guidance, right? So you want to go to a clinician that is able to use ultrasound. You know, they've been taught to use ultrasound. We're going to show you some really compelling slides here in a minute with that. But you also want to find someone that's trained in prolotherapy. So someone that has been trained in prolotherapy is going to be much better to be able to treat all of these ligaments, because that's the training that they get. And it's not something that you can take a weekend course and then all of a sudden be an expert. It takes years. You know, we've been studying this stuff for almost 30 years, and you know, we're still learning. This is the shoulder. You've got the capsule and all these different ligaments in the shoulder. It's not a normal state of the body pain, and it's an indication that there's something going on, and I hope you guys are starting to get a little bit clearer as to what that might exactly be. It's not such a mystery. It's not just this word arthritis, right? I think we should rename arthritis. Let's call it loose ligament rough cartilage syndrome. How about from today on, everybody calls it that? You guys agree with that?
Yes.
It makes more sense, right?
Yeah.
Another little analogy here. So imagine I'm driving down the road. I think that a lot of us take better care of our car than we do of our body,
Oh, yes, true.
right? So I'm driving down the road and the overheat light comes up on the dashboard. So I pull over and I get a little piece of black tape and I put it over that light. And I get back in the car and I keep driving down the road.
That's not going to do anything.
So how many people here think something more serious might happen to that car?
Oh, yeah.
So now let's take that and apply it to, say I'm out golfing and I'm not paying attention. I step into a hole and I twist my knee and my knee starts to swell and it's sprained. And I go over to my golf bag and I pull out a bottle of non-steroidal anti-inflammatories like an Aleve or something. And I take the Aleve and I maybe drink it down with a beer because I'm looking to kind of numb the pain, right? And I keep golfing. Is there a big difference between those two?
No.
Pretty similar, right? So if I were to have taken the advice of that orthopedic doctor, I would have been looking at a recovery of 3 to 12 months. How long do you think my recovery was after that Wolverine powder?
2 weeks.
It was pretty quick, yeah. Days. 30% of them don't heal completely. And if they're big, 60% of them don't heal. And so now, when we use the products that we use, imagine that we're injecting a tear and we're doing it skillfully. We can see the tissues. We're injecting it right into the tear, and you're watching it go in as a liquid, right? And you're seeing it go into all these little cracks and crevices. And then it fills into all those cracks, and then it turns into a solid. And then over time, all of that material turns back into tendon. Because that's the way the body heals anyway, but why won't it do that automatically? The only reason I offer to you all, the only reason is because there's not enough blood supply. Otherwise it would. So all we're doing in this medicine is taking things that your body is trying to get in there to do naturally. Spinal surgeries. You know, it doesn't take a rocket scientist to realize if I fuse this, that this is going to go shortly after. Right? That's going to be a lot of extra stress. That disc is going to probably blow. That's why 72% of people after a spinal surgery need a second and third procedure? That's downtown Sarasota.
Oh my goodness.
I guess that mailman used to be a refrigerator repairman
Plumber.
or a plumber, right? There's 3 different ways we can inject. There's blind, which means we're not using any imaging, and that's not always bad, depending on what you're up to. Number 2 is there's fluoroscopy, and so fluoroscopy is when it's an X-ray guided, and they're usually taking snapshots as they go. It's not usually like an ongoing image. So they're having to clip quick pictures and see, oh, check, okay, where I'm at, all right, I'm there. Very, very easy, something that could be learned in probably a day. I could probably teach a physician to be an expert with that in a weekend, no problem. Doesn't show any soft tissue, only bone, because that's all X-ray shows is bone, okay? And then there's ultrasound. And ultrasound is dynamic, meaning that it's going all the time, so you're constantly being able to see where you're going. And there's a lot of benefits with ultrasound above and beyond really even MRI. You can see smaller tears better than MRI. You can see calcium deposits, which actually become a big problem with a lot of your all's condition, which we have very exquisite procedures to reduce those calcium deposits with our procedures. But if you don't know they're there and you can't see them, there's no way you can really address it. And it's been shown to be a better diagnostic tool for a lot of different types of arthritises. I mean, you can see all the soft tissue. You can see bursas, you can see blood vessels, you can see ligaments, tendons, cartilage, meniscus, it's all there. So then you can see what's torn, what needs to be treated, and then you can guide the injection. So why isn't this just something everybody's using? I mean, honestly, why doesn't your primary care doctor just whip out an ultrasound and take a look at all these things when you show up? Because it is really hard to learn. Like, really hard. I still struggle a little bit with it, and I've been doing it for 10 years. So the training is incredibly rigorous. So there are very few physicians that are able to do more than just some very basic things with ultrasound. This was a study out of the Journal of Rheumatology. So can you imagine like blind injections? These are doctors that had at least 15 years of experience. Only 40% of the injections in the shoulder actually went where they thought they were going to go. That means 60% of them missed. You know, would you want to go pay $5,000 for a stem cell procedure on your shoulder when a doctor is going to do a blind injection? No, sir. You want them to use imaging, right? So the only 2 routes of imaging would be fluoroscopy or ultrasound. But if you use fluoroscopy, they're not going to be able to see what's going on with the rotator cuff. How important is that? Pretty darn. And then you also have the labrum. You know, there's a lot of important structures that you can't see. So again, I would say you want your clinician to use ultrasound and to be proficient with it. So where do we get stem cells? Bone marrow. So as we get older, a lot of people probably have heard, hey, you know, are my stem cells still good? You know, because I'm getting older, like, you know, I'm not in my 20s anymore. So it's true that stem cells start to decline as you get older, but primarily in the long bones. Not so much in the pelvis and the vertebral body. So we collect stem cells from the bone marrow, primarily in the pelvis, and we have a lot of success with this. And our majority of our patients are, you know, between 50 and 90. About a year ago, we started utilizing a new aspiration device. So for a lot of you out there, I'm starting to talk about bone marrow, and you guys are a little bit squirmy. Oh my, I heard that hurts, right? And probably for a clinician that wasn't good doing it and being careful to make this a comfortable situation for the patient. The inside of bones don't have a lot of pain receptors. The periosteum on the very outside does, and the skin, of course, and the different muscles and so forth. So when we do a procedure, we numb up the skin all the way down to the periosteum. And then we'll have you breathe nitrous, the laughing gas that a lot of times dentists offer. So you go into a bit of a dreamy state. And our goal is for patients to get up and tell us, hey, that was like not bad at all. And 9 out of 10 patients do. Now, there are a few people that will say, hey, that was painful. It's rare, but it can happen, just the way things are designed and built, and nerves and so forth. But the majority of people really sail through it with no problem. So a year ago, we made a huge leap forward in our procedures. This is an aspiration device, and this little bar graph is showing how many stem cells was collected from this aspiration. Okay? This is a bar graph showing how many stem cells were collected from an aspiration just using a different device. 60 times more stem cells. So when we started using this new device, our results, way better and quicker. Because it used to be that we'd have to wait, a few months before people would start getting better. Now it's much less, at least half the time. So this device it doesn't change what we do. I mean, we still, penetrate into the bone and we're still pulling it, but it's just the way it was designed. It's much more expensive. The device is much more expensive. This device costs $20. That's what we used to pay for it, 20 bucks. This device costs $1,500. So we use that device almost all of our cases, and we've only raised our prices by $500 for bone marrow. That's it. We're just paying that forward with our patients with better quality. So what would it look like if you came in and received a treatment? Now, we do other things besides bone marrow, but we're talking about bone marrow, so let's kind of go through it. You come in and you're going to get your blood drawn, right? Because we need scaffolding material, right? So the blood's drawn, that goes down to the lab. Patient's breathing the nitrous gas. Bone marrow's being collected. Patient's not feeling any pain. Communication back and forth, very clear. She's even smiling. And then under ultrasound, we're injecting the finished product into her ankle on this one. And then she goes to another room and gets some laser and some ice, and she'll be able to walk home. Or not walk home, but she'll be able to walk out of the clinic. And usually people are going to be sore for a couple of days. Most people don't even need pain medication to manage the soreness. So it's usually, mild to moderate pain. This was a study. They wanted to see what would be the difference between if I did a joint replacement or I did stem cells with bone marrow. And they followed these people 3 years down, and they wanted to see what's the difference. And basically it was very similar, except the people that had stem cells were more likely, 74% more likely to go back into athletics if they were in athletics before that, where they were only 64% if they got the joint replacement. But on top of that, and this is important, is the downtime, right? How many people here have been through a surgery? I can raise my hand. Okay, keep your hand up if you want to do another surgery. Nobody wants to go into a surgery. It's terrible. It's scary. And, as we get older, we just don't bounce back like we did, right? And then you're always running terrible risks, with anesthesia and blood clots and stroke and all these types of things. So, say this is a big win. So, how many people here have heard of exosomes? One. Usually it's none, but good. So how stem cells really work and how we thought they worked is a little bit different, because in the last few years we've discovered a little bit of a nuance. So it used to be that we thought stem cells home in on damaged tissues and they fuse to that damaged tissue, and then they start to multiply and differentiate into various cell lines to create new tissue, right? And what they're finding is that it starts out the same, where the cells are drawn to that area and they do adhese. But what's happening is they're discovering that they're releasing these little vesicles that basically shower all over of that tissue and bathe that tissue in these exosomes from stem cells. They're stem cell derived exosomes. Okay, there's different exosomes from different cells, but so they're stem cell derived exosomes. So they bathe the tissues, and the tissues that are there, like you remember that picture, that knee that's all beat up, like those cells and tissues are getting showered, and they're signaled to go into a youthful growth repair phase. So it's those cells that are already there that wind up actually multiplying and growing. So it's kind of, how many people here like Star Trek? I love Star Trek. It's like, okay, the Klingons shot the Enterprise, and then these are escape pods, right? So these exosomes hold the stemness to the stem cell. So even if we use your bone marrow, ultimately, it's an exosome reaction that's doing most of the work. Now, the FDA says we can use exosomes. I don't know how long that's going to last, but as of right now, we can use them. And we use them where they're derived from placental stem cells. So they're from youthful, robust cells. And we feel that that's safer than actually using cellular products, and more effective and more consistent. And I'll tell you why. When you freeze cells, a lot of times they don't survive that. So, we do have cord blood stem cells that are frozen as well. We don't use them very much. But so the benefits of using exosomes is that it's very pure, because these are such tiny vesicles that they can be filtered to get rid of all the different blood cells, any bacteria or any impurities. So it's really, really pure, super safe. I had this injected into my own mom. Like, I had my mom treated, it was about 9 months ago. We even did an IV with her. I've done an IV with these exosomes. It's unbelievable. I mean, I was like, I don't know, I was like, what is in this stuff? Like, it was really something special. So they're super safe to do stuff like that, right? So they're very safe, and when they're frozen and they're thawed back out, you don't have to worry about cells dying. There's just as many exosomes there before being frozen as they were after. This is a study showing potential of stem cell derived exosomes in stroke, Parkinson's disease, osteoarthritis, complete restoration of cartilage in 12 weeks after a single intra-articular injection. This is placental derived exosomes. So what's merisome? So this is the way we look at it, is we have a patient come to see us, and if their arthritis, wear and tear, okay, we're not going to use that word anymore. See, I just broke my own rule. If their loose ligament, rough cartilage syndrome is mild to moderate, we can take their blood and use the PRP and add exosomes in with it, that combination. If it gets to be moderate to severe, we're starting to think we want to use something even stronger, so we do exosomes, PRP, and bone marrow. And that's what merisome is the combination of all three. Now, how would you know where you fit in that? Well, you need somebody like me to tell you. And so at the end of this, we're going to be giving you an opportunity to come in and get an ultrasound scan and get a consultation, so that you'll know exactly where you stand and what would be recommended. So This is a machine that we've had this almost a year, and there's only one other of these machines in Sarasota, and it's a urologist has this machine, and he's treating prostate conditions and erectile dysfunction, and he's not doing anything besides just some of the applications there. We are the only other machine. We do treat those things in our practice, but we primarily use this machine for things like neuropathy and for regeneration of ligaments, tendons, muscles, joints, etc. And it's a small version of something called lithotripsy. So in the hospitals, they have these big lithotripsy machines that break up deposits in the kidney stones. And so these kidney stones, they get broken up, and so they found that the same technology has all these incredible benefits to the human body. And we've really just found this machine to create just quick and very robust relief for our patients. And it's called a TRT, Tissue Regeneration Technology. And I've got a little video. It's an acoustic wave device, uses the power of lightning and sound and energy. It pulses into the body, and it's just amazing. You had chronic neck and back pain for like 30 years. What was your experience?
Well, I've been a recipient of this technology. Within 2 weeks, I had 3 sessions. I sort of speeded up my sessions because I was in so much pain. Mm-hmm. I had 2 failed back surgeries from a fall on the coccyx, mm-hmm. my tailbone, and a whiplash from a car accident, and I had a fusion at C5-6, and I haven't been able to get out of pain. But within 2 weeks, and I am not kidding, I am totally pain-free. Mm-hmm. This weekend, now it was Friday, I had my last one, so this weekend I was out pulling weeds in my garden. This is something I haven't done in 10 years or more.
Wow.
So I'm really, really happy over this technology.
So really, really amazing. So we are using it in conjunction, so a lot of treatment plans that we're recommending patients for like a knee or a spine, we'll do the injections of the stem cells, and we'll also do a series of these. It's best done in a series of 3 to a specific condition, usually a week apart. So what are some things that we want to look for with a practice or a doctor that's doing regenerative medicine? I think you guys could probably recite this by now, but we want someone that's got a long history, right? They've got experience. It's important. And they've got more than one tool, because there's a lot of different problems that can arise. There's a lot of different conditions and presentations. So the more tools that they have, the more that they'll be able to cater their treatment to you in the best fashion. And absolutely that they're using ultrasound imaging, both to diagnose the problem, but also to guide their injections. Very critical. And then if they've got training as a prolotherapist, even better. And supporting therapy, I think, is important. I think the TRT machine that we just talked about is just phenomenal. We have several other machines that we use in our practice. You're going to be given a brochure on your way out, and there's a lot of information about our practice there. And then, of course, our website will be on the brochure, and there's just a wealth of information, all the different modalities. Just to kind of give you a bit of a synopsis, we treat a lot of patients with chronic Lyme, mold illness, viral infections, a lot of autoimmune. Because of my background in neurology, we treat a lot of patients with different degenerative neurologic diseases, Parkinson's, Alzheimer's, MS, a lot of dizziness and vertigo and balance conditions. We do a technique called Lumamed, which is a treatment for tinnitus and hearing loss. using laser therapy that's phenomenal. We actually have done some talks just on that subject alone in the past. And then the orthopedic work that we do with regenerative medicine, of course, that we're kind of focusing on tonight. So how long does it take before we see results? Well, it's not like you're getting a steroid shot or you're taking a pill where you get results right away, right? We're kind of used to that. With regenerative medicine, you have to wait for the body to heal. So you're creating this stimulus, and then the body's got to take some time. If you're looking to rebuild cartilage, that's going to take the longest amount of time. If you're looking to repair a ligament or a tendon, that doesn't take as long, usually 4 to 6 weeks. But when it's the majority of the cases that we do stem cells on are joints, and that can be anywhere from 2 to 4 months before real results start to kick in. And like I said, we feel like our results are much quicker since we've been using the device with the bone marrow. And also, the exosomes now are even a year ago where we were sourcing, they're way better. So it's really a great time to be receiving regenerative medicine right now, especially in our practice, just even compared to a year or two ago. And it's funny, every year, I just don't think it could get that much better. And then there it is. There's these new techniques, these new devices, this new TRT machine, and it's just breaking the mold of what we thought we could accomplish with cases, or things that we thought we could even treat. Just unbelievable. I think that machine's going to really revolutionize healthcare. I don't even have time to get into all the things that you can do with it, but I'm obviously very excited about it. So when's a good time to get treated? How long do you wait and be in pain? And when you're in pain, we're not as happy as we could be, are we? And if we're not as happy, we're not going to treat our friends and family as well, right? And if we don't treat them as well, they're probably not going to be as happy as they could be. Then the world's not as happy as it could be. We got to stop running into coffee tables. Now that you guys have a little bit more of an idea as to the cause and effect, you can start being a little bit more concerning as far as like how you're treating your body and what type of strategies you're using to get better, and whether you really want to be functional till late in life. Do you want to take care of yourself where your body's going to be functioning? Or look around at some of the homes here. We're in Sarasota. These people get put in these retirement homes, and because they don't have mobility. Granted, there's a lot of people when it comes to some mental stuff with degenerative neurologic, which there's a lot that we're doing on that. It's another seminar I could do. But a lot of it's mobility, isn't it? Listen, I really enjoy this, and I think we all have this pain to purpose story, right? I'd like to be a part of your pain to purpose. There might be some beautiful things that you could do when you get over whatever you're looking at facing here. And I've been in that situation where I've had chronic pain. I had Lyme disease for 10 years, and I didn't know what it was. I was going to all these doctors, and they were telling me this, that, and the other, and I finally tested my own self, and I found out, oh my gosh, I've got Lyme disease. And there was a lot of pain associated with that. And it was very frustrating to me as a doctor because I had all these tools, I was all in this regenerative medicine and it wasn't working. And I'm like, there's something different about this pain, right? Well, it was an infection. I know what it's like to suffer. And I know what it's like to not only suffer, but to be in that situation and to feel hopeless. So I hope that I was able to shine some light on some of these mysteries where maybe you don't feel so hopeless, and at least kind of crack things so that you're kind of starting to see things a little bit different. And take me up on this consultation, come in, and let's explore this together. For more information about these exciting regenerative therapies, you can find us at advancedrejuvenation.us. You can also contact us by phone at 941-330-8553 or email us at info@advancedrejuvenation.us. If you found the information on this video helpful, please like us and share us on Facebook. You just never know whose life you might touch. Well, thanks for joining us. And remember, if healing is possible, consider it to be within your reach. Bye for now.